This is Andrew Hershey, and I'm here today with a group of pediatric headache experts to help discuss how to best manage and improve the outcomes of children with headaches. Christina, do kids get headaches, and how do we recognize what they are?
Absolutely. So headaches are actually very common in kids. By the age of 15, 3 out of 4 kids will have had a significant headache. Many of these are due to infections like the flu or strep throat. But in kids with recurrent bad headaches that come back over and over, it's usually migraine. What do I mean by migraine? Migraine is a bad headache which is pounding or throbbing and comes with things like nausea, vomiting, sensitivity to light, and sensitivity to sound. These headaches cause a lot of disability. Kids miss school, they miss other activities, and unfortunately they're very common. In younger children, ages 5 to 15, it occurs about 1 out of every 10 children. But in older teens, it occurs up to 28% of the time. So it's a significant problem.
Amy, so how do we recognize headaches in kids before they enter school?
So migraine in babies and young children can look different than it does in older children. For example, in some younger children, migraine can manifest predominantly as recurrent episodes of belly pain with nausea and vomiting rather than headache per se. And we now know that in infants, infant colic, excessive crying, can actually be an early manifestation of migraine. So children who have migraine headaches in later childhood are more likely to have been colicky as babies, and mothers who have migraine are more likely to have colicky babies. And so we're increasingly recognizing that migraine looks different in young babies and kids than it does in older kids.
So Paul, can you tell us what we can do once a kid has a headache to make it stop?
Yes, and the most important thing is to understand that we have good, effective treatments that control headaches in 1 to 2 hours. We can empower you to control the headache and not let the migraine control you. Today there are effective therapies for children 6 and older, which we have excellent data that your doctor can help you with. Now, if you do not have full control of your headache in 1 to 2 hours, you should go back to your physician, allied healthcare professional, and get a treatment that is effective in 1 to 2 hours, because you can control your headaches. Your migraines shouldn't control you.
So Marcy, when children have frequent headaches, what can we do to help them prevent their headaches?
There are many different strategies for preventing headaches in kids. In particular, we talk about health habits that may be influencing their headaches. And if those things aren't the problem, then daily preventative medicine is a good idea. Daily preventative medicine isn't forever, but it can often help a child to attend school for a year and not suffer. And then when school is over by the end of the year, then you can taper medication. There are many medications that we've used for many years that are safe and effective, and we know what the problems with them are and what the problems with them aren't. Many children are taking frequent medication anyway, and so this actually helps to reduce the amount of medication that they take by taking something every day.
So Scott, besides medicines, what can we do to help kids control their headaches?
You know, kids and adolescents are really good at learning skills to control their headaches. One of the things they can learn to do is healthy habits like regular exercise, drinking lots of liquids, eating regularly, and getting good sleep. In addition to that, there are specific skills they can learn, like relaxation strategies and other coping skills that they can use throughout their life. In fact, once they learn them, they get to keep them. We know that these types of skills, when kids apply them, reduce their frequency of headache remarkably, as well as decrease their disability, so they can fully participate in their life. And the kids and adolescents find that it's really fun.